Okay, hello everybody. My name's Victoria Betton from Mindwave, and I'm really delighted to be interviewing John Torous from Boston here today. John, tell me what your job title is and what you do.
Yes, so I'm the director of digital psychiatry at Beth Israel Deaconess Medical Center. So there aren't too many directors of digital psychiatry that I know of. I hope we have more soon. But in this role, we have a small division and we do teaching around how to use technology in mental health care. We run a clinic where we integrate technology directly into patient care. We do research on new technologies like smartphone sensing for mental health, and we do advocacy around standards for using technology in care.
Cool. And John, you must be the most prolific person I know when it comes to producing articles and publications on digital mental health. And recently you produced a really interesting article in the Journal for Medical Internet Research that argued that we should bend the curve, that we should accelerate digital mental health, taking into account this particular very strange time we find ourselves in with COVID. Could you maybe just summarize some of the key themes that you covered in that paper, please?
Exactly. So in this paper, we said, I think around the world, no matter where you are, we've seen that telehealth has really stepped up for mental health care. I think most mental health visits are being done via video, or sometimes it's called telepsychiatry or telemental health. And I think we've seen that mobile health, kind of smartphone apps and other programs, have a role too, but it hasn't quite been the same role as telehealth. And again, I think no matter where you look, you've just seen it. Telehealth has really been ready to go. And I think the question we asked is, telehealth has been so successful, and what is necessary to make mobile health, digital health, wearables, apps, how do they kind of add to this picture and augment it? And the reason that's so important to augment and add digital health within these apps and sensors is when we're doing telehealth or telepsychiatry, it's almost like this interview, right? It's synchronous, it's one-on-one. It's one clinician working with one person, and that's important, that's good, that's the core of it. But when we can move towards apps and wearables and monitoring and digital interventions, computer programs and therapies, then it becomes closer towards asynchronous telepsychiatry. And that means one clinician can be working with many people at the same time. And I think that's how we're actually going to really bring care to more people. If we really want to increase access to care, we're going to have to find a way to bring in the mobile, the digital, the computer therapies. And doing telepsychiatry video visits will increase access to care because we can distribute our clinicians better, right? A clinician in Glasgow can see someone in London, I in Boston can see someone in California. So we kind of can make sure our distribution is right, but we really do have to take the next step towards asynchronous telehealth. And I think that's where we can say, because the healthcare system is going to change and is changing in response to COVID, and we're doing more video visits, how do we make sure as we make this shift that we do it in a way that builds us for success to build a new system that takes into account even more data, this wearable, these apps, and these sensors?
We've seen during COVID a real stark, we knew it already, but we've seen really starkly the haves and the have-nots, the health inequalities. And in your paper, you do flag that up as a concern. So how in this acceleration of digital mental health, how are we going to make sure we don't create a two-tier health system or leave people behind?
I think that the most pressing issue we have to consider is, are we going to increase access to care, or are we going to actually make a digital divide? Are we going to exclude people that aren't able to partake in this? Let's call these digital first services. And I think to really make sure we address that, that's actually not a technology problem. One could argue that we have the apps we have today, the sensors we have today, the algorithms and computer programs, they're very good. But the problem is they haven't yet reached the right people and been deployed in a healthcare system. We don't have a structure and a framework for the healthcare system to embrace these, to put these into workflow. So there's probably some work on the healthcare system, but there's also work on digital health literacy. We actually have to help people learn how to use some of these programs, learn how to use their smartphone. We've had a program in Boston called DOORS, Digital Opportunities for Outcomes and Recovery Services. And it's a 6 to 8 week group. One hour a week where we go to community mental health centers and teach people how to use a smartphone.
Mhm.
And many people may have a phone, but no one's actually told them how to download an app, how to make an Apple ID, how to use the alarm feature to track when you want to take a medication, how to use notes to kind of keep track of important medical information. There's a lot of skills, if you think about it, to actually use a smartphone to navigate this technology, to use the web to kind of pull up a video visit that some of us certainly can do intuitively and natively, but sometimes some people really just need a little bit of training. And people can learn these. Digital literacy skills are very learnable, very teachable, but there's almost zero focus on digital mental health literacy.
Yeah.
And I think as we're beginning to build these systems that are going to focus more on digital mental health, we really have to kind of offer that hands-on guided education. So it's not fancy, it's not machine learning, it's not a new app, it's not a new device, it's working with people and helping them become ready to use technology. And I think we can do that as one way to reduce the digital divide, is really kind of focus on people and what people need, not just technology numbers.
And just to build on that, you've introduced this idea of a digital navigator, and I think you might have digital navigators in your services. Could you tell us, because that seems to be an interesting, promising new approach as well. Could you tell us about that role that you think will get developed more?
So a digital navigator would be something that kind of works in a country or organization's digital mental health plan and their strategy. And the idea being you have a lot of clinicians, they're already trained, they're giving great care today. And we know it's very hard to implement change into healthcare. We have centuries, if not decades, of evidence. And that we know that just giving people new technology isn't going to fix everything. We've had smartphones for 10 years, and we haven't seen mental health outcomes dramatically shift.
Mm-hmm.
So the idea of a digital navigator is going on the health system. Well, let's take an analogy. If you visit a doctor and you're going to get an x-ray, and the radiologist says, I want you to get an x-ray or a different type of scan, the radiologist actually isn't going to run the MRI machine or take the x-ray. There's going to be a radiology tech who helps explain to you what the procedure is. They're going to take the x-ray, they're going to check the quality and kind of report back to the radiologist. Or if you're getting, for pathology, if you're getting a biopsy done, it may be that the clinician is part of it, but part of the initial staining and work is going to be done by a technician. So what if we had a new type of role, a digital navigator? And we know that the therapeutic alliance and human connection is so important in mental health. So what if this person isn't really a technician in the sense of the word, but they're really a connection between the technology, the person who needs care, and the healthcare system and the clinician. So the way that we use digital navigators in our clinic is that I may see a patient and we may say, you know, really, we want to learn about sleep and mood. Let's track those to see how someone's responding to treatment. The digital navigator will come in at the end of the visit, and I'll explain to the digital navigator, I really want you to help set up technology to track these things. The digital navigator will then work with the patient, customize the technology, teach any questions they have, help ensure data quality. And then when the patient comes back in 2 weeks, the digital navigator will kind of have printed out and summarized the data we have. So we're not spending our clinical time looking for passwords, setting up the app, typing things in. We're really just kind of saying, hey, let's get some great technology on board and let's have some data to look and talk about next time. Equally, we use a digital navigator to help us find an app. If we say, no, we really want an app to help build therapy skills, the digital navigator can say, look, there's a lot of apps out there. Let's work with you to kind of find one that matches your personal preferences. So I think the digital navigator really can help the healthcare system kind of bridge implementing these new technologies, and the digital health literacy can make sure everyone's kind of ready to embrace and use it. So both the digital navigator and the digital health literacy, these aren't technology solutions. These are focusing on people. And I think they'll let the healthcare systems, they'll let patients and people use the technology to its fullest extent.
So building on those two roles, those two non-technology sort of components, what else do you think we need to have in place if we're going to leverage some of the acceleration that we've seen during COVID? I know, for example, you've done quite a bit of work around compliance standards for digital mental health.
So I do think we need, the analogy that we like here in the United States is the Wild West.
Mm-hmm.
And I do think that we need some law and order, some rules and structure. We do need the healthcare system likely at a national or federal level, giving some guidance and some structure for how this is going to grow and how this is going to evolve. What are the minimum standards? How does reimbursement actually work for these things? What are the right protocols to consider using this in? I think that we've seen telehealth was adopted so quickly during COVID because there was national support for it. There was national legislation around kind of issues of who could use it, of licensing, of reimbursement, of liability. So we really saw the healthcare system kind of have a plan around it. It was a plan that formed quickly. And I think we need to begin seeing that same thing focus on digital mental health too. In part, we could do so much so quickly with telehealth because there was a really robust evidence for it. We knew what telehealth was. There's been decades of evidence. There's been many meta-analyses. There was a lot of experience with it. So I think in part, we may need more underlying research to build confidence, to help people know what it is, how it works. But I think in parallel with that kind of evolving research, we really then need to say, what is a national strategy or plan for using it? It can't just be we're filling a hole here, we're filling a hole here, and we're filling a hole here, because those are temporary solutions. And I think what you and I are talking about is a permanent solution going forward, really towards increasing access to care and quality to care.
Yeah, that makes sense. Thank you. And just to finish up, John, just thinking forward, sort of as we hopefully start to emerge from the pandemic, what do you think's a desirable future? What's the future that you hope for? And what do you think's a likely scenario? And are those two things different?
So I think the exciting part is it really is up to all of us to see which way we go. I think this is certainly a time of change in healthcare, in the world, and in especially mental health care. And I think with the right advocacy, energy, and commitment, I think we can take it towards a path where we really are putting mental health care in the hands and wrists of people via digital devices. We're not limiting access to care in terms of face-to-face visits, but we're really giving people so many options and ways to connect with us, be it text messaging, which can work on any phone, be it apps, be it remote therapy. I think we really can have a system, and there's enough feasibility evidence that this could work, that we can really increase access and quality to care through these devices. I think the risk is, again, that we just have this patchwork of different things being tried by different people, but it's hard to understand what's happening. These are kind of all temporary efforts. They do well and they disappear. So I think the future we want to avoid is still the Wild West of this happening. I think we'll, of course, see some successes, but I think we really just have to move towards a place where there's a lot of transparency. We're saying what really works and what doesn't work. Not everything's going to be a home run. I'm not sure what the cricket equivalent of that is, but certainly, I guess full wick. I'm going to stop making a fool of myself. But we have to really think, how are we going to kind of have a level playing field to talk about what's working, what's not working, what are the policies supporting it, and really treat digital mental health like any other new healthcare innovation. We ask the right questions, we have the right policies in place. It's a new tool that we can support and use. And I think with that approach, we can move towards, just like telehealth has had such a huge impact in the last 3 months, I think we can kind of accelerate that impact and go farther once we kind of add on this digital and mobile health.
John, you've been a star. Thank you so much for your time. Really appreciate you sharing your insights. And yeah, thank you very much.
Thank you very much too. Bye.